Welcome and thank you for joining us this evening. We're so glad you could be with us for a discussion about this very important topic, especially given our current economic climate of pre-retirement individual healthcare insurance. For those of you who don't know me, my name is Sandy Adams. I am the lead financial planner and partner here at the center. But our real star of the show this evening is Cynthia Brown from Powers Financial Benefits. Cynthia is an expert in the area of individual healthcare insurance and Medicare, as you will find out if you are interested in our webinar next month. She is our trusted advisor when it comes to the healthcare insurance area. Before we begin, I do want to remind you that this is a part one of a part two session. We do offer you the opportunity for a one-on-one session if you're interested to go over this material in relation to your specific situation. So do not hesitate to reach out to us if you're interested. I know that Cynthia has a lot of information to share with us this evening, so let me hand the mic over to her and introduce to you Miss Cynthia Brown.
Well, thank you, Sandy. Thank you for that nice introduction. And as Sandy said, tonight we're going to look at individual health insurance options for those of you that are not yet eligible for Medicare and don't have group health plan coverage available. So I do thank you, Sandy, for the opportunity to speak on the subject, and also a big thank you to those of you who are listening in. Just a little bit about myself. I've been an independent licensed agent for the past 27 years. And I enjoy helping people navigate their individual health insurance options, and also, when the time comes, helping them make that smooth and painless transition to Medicare, emphasizing painless. And as Sandy said, speaking of Medicare, there will be a separate Medicare webinar on October 10th. So if you are getting close to that chapter in your life, you may want to join in on that one as well. So we all know that a lot has changed in the health insurance arena over the past few decades, most notably in 2014 with the implementation of the Affordable Care Act. So big changes came about. Some of those big changes were insurance companies can no longer deny coverage or charge higher premiums based on health conditions. They also cannot impose any pre-existing condition limitations. And additionally, health plans have to include a specific set of essential health benefits, which we're going to talk more about later. But these changes, while good, overall brought about higher premiums and higher out-of-pocket cost sharing for the consumer. Some people, however, are, based on income, eligible for premium tax credits, also known as subsidies, which reduce the cost of coverage. And moreover, in certain income ranges, there are those folks that qualify not only for premium tax credits, but also for cost sharing reductions. So cost sharing reductions lower the plan's deductible, the copays, and the out-of-pocket max. So now we're going to fast forward to 2021 when the American Rescue Plan Act was passed. So this legislation not only increased the dollar amount of subsidies for those that were eligible, but also expanded subsidy eligible, so more people qualified. This expansion was set to expire at the end of this year, but the good news is that under the recently passed Inflation Reduction Act, they have now been extended at least through 2025. So with that, let's dive in and just take a look at some basics. We're going to start off with what is the marketplace, because you'll hear that term off-market and on-market. Well, the marketplace, simply put, is just a shopping experience and enrollment service for medical insurance. And most importantly, it's the only way that you can obtain premium tax credits, also known as subsidies, that you might be eligible for. But I want to mention just briefly off-marketplace. So off-marketplace simply is when a consumer goes directly to the insurance carrier for their coverage. Most plans that are offered on marketplace are also offered off marketplace, and vice versa, with a few exceptions. So why purchase off marketplace? Well, the reason to do that would be if you're not eligible for a subsidy, the enrollment process is a little more simplified off marketplace, and there are a few full price plans that are less expensive off marketplace. And I'm going to give you an example of this later on in the presentation. But either way, whether on or off marketplace, I highly recommend you work with an experienced, independent, marketplace certified agent to not only determine whether you should enroll on or off marketplace, but to take advantage of the education and expertise that they bring to the table beyond what you're going to see as a consumer when you're looking at a benefit summary online. And moreover, agents can provide ongoing service while you're covered on a plan. And the best part is there is no cost to working with an agent. So enough said on that, but let's just look at who can enroll on the marketplace. So it's pretty simple. You must live in the United States and either be a U.S. citizen, U.S. national, or lawfully present immigrants for the entire time that you plan to have the coverage. And you also cannot be incarcerated. So when you're applying on the marketplace, they do ask that question several times. And what do individual health plans look like these days? Well, they can be HMOs or PPOs, although there are very few PPO offerings anymore. If you're on the marketplace, the only carrier that offers PPO is Blue Cross Blue Shield of Michigan. And off marketplace, HAP also offers PPOs in addition to Blue Cross. So not too many PPOs, mostly they're HMOs. They can also be HSA eligible type plans, or they could be more your traditional type of plans, but they are going to be broken down into 4 categories, and they're metallic level categories. We've got bronze, silver, gold, and platinum, although I haven't seen a platinum level plan in this area in a number of years. They've just become cost prohibitive. But basically, the better the metal, the higher the premium's going to be, but the lower the out-of-pockets, like the deductibles and the copays and the co-insurance. I will say that most people are on bronze level plans these days, just due to the price point that they're at. There is one other category of plans available that is not a metal level plan, and that is something called a catastrophic health plan. The way they've named these plans, it's a bit confusing because even though they're called catastrophic, they still have to include all the essential health plan benefits that any other plan has. But they are only available to young adults under 30. They have high deductibles, so they look a lot like bronze plans, but they have to cover at least 3 primary care office visits per year before deductible and certain preventive services with no out-of-pocket cost sharing. So again, very small number of people are eligible for these. You have to be under 30. But let's talk about the essential health benefits. So now, since 2014, plans have to include these items that are listed here, like ambulatory patient services. So that's like your doctor and your clinic visits, emergency and urgent care services, hospitalization, maternity and newborn care, mental health and substance use disorder, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, lab services, preventive and wellness, chronic disease management, as well as pediatric services. So prior to the Affordable Care Act, plans could carve out certain coverages. For instance, with some plans, you could carve out maternity, or you could carve out prescription drugs. Some allowed you to carve out mental health. So there was, certain cost savings available if you were, willing to carve out certain coverages. But that's no longer the case. Plans have to include these benefits. So between having to offer all of these benefits now, and also not being able to ask applicants health questions or exclude coverage for pre-existing condition, it has really driven up, the cost of coverage. And I want to just touch on real quick the rates that have been filed with the state of Michigan for individual health plans for 2023. So these are proposed rates. They've not yet been approved, but you can see with all the different carriers that are offering individual health plans, the proposed rate changes for next year. Now, I want to emphasize that these, again, they're proposed, not finalized. They're also average increases. So when you look at, for instance, Blue Care Network of Michigan, and it's showing a proposed rate change increase of 8.6%. That is across, that is all their plans combined. So there could be Blue Care Network plans that are getting a 10% increase. There could be plans that are getting a 6% increase. So it's an average of all the plans. And also something else to note is plans go up, individual plans go up as we get older for age. So any age-related increase are not reflected in these inflation increases. So basically, if a plan had a 0% inflation increase, you would still see an increase for being a year older. If you are eligible for a subsidy on the marketplace, you're a bit insulated from rate increases, because as the cost of your coverage goes up, the cost of the premium tax credit or the subsidy also goes up. So on marketplace, if you're eligible for that subsidy, you're just going to be better insulated against these increases. So the slide also is interesting. It shows the current enrollment in plans. So the carrier right now that has the most individual enrollment is Priority Health. And second to that is Blue Care Network. We can also see that the rates filed range from a negative 2.8%. So actually a decrease with Blue Cross Blue Shield of Michigan, PPO plans, all the way up to an increase of 12.9% with physician health plans. Something I want to mention that I came across just the other day is, and I haven't seen anything from the carriers on this yet, but Governor Whitmer on August 18th, she directed in a letter to the Michigan Department of Insurance and Financial Services that they require Michigan health insurance companies to reduce their previously filed health insurance rates for 2023. So these are what were filed. It'll be really interesting to see, what happens with this. Is there going to be, are they going to direct carriers to reduce these rate changes? So that remains to be seen. We won't know for a while yet, probably close to the open enrollment period, what the actual rate changes will be. But this just gives you a picture of what was filed a few months back. So let's talk about premium tax credits. Subsidies may be available to lower the cost of coverage, for consumers with certain household incomes who aren't eligible for other qualifying coverage. So for instance, if you're eligible for Medicare or Medicaid or CHIP, or you have, job-based insurance available to you, you're not eligible for a premium tax credit. People that have employer coverage, they could certainly still choose to forgo that coverage and enroll on the marketplace, but they would not be able to get a premium tax credit if that employer coverage is deemed affordable. So prior to the American Rescue Plan Act, so that was just last year, if you were between 100% and 400% of the federal poverty level, you would receive reductions or premium tax credits on the cost of your coverage. Now, I want to qualify that a little bit. Michigan was one of the states that expanded Medicaid eligibility. So in Michigan, if you are at between 100% of the federal poverty level and 133%, rather than being eligible for a premium tax credit, that would put you into Medicaid eligibility. So if you are eligible for Medicaid, then you are not eligible for a premium tax credit. So moving right along here. Oh, and I believe I mentioned earlier, but I just, want to reemphasize that premium tax credits are only available if you enroll through the marketplace. So this next page, this chart is pretty complex. So I'm going to try to make it a little simple here. But basically, first thing I want to do is define benchmark plan, because we're going to have that terminology as I explain this slide. But what a benchmark plan, it's simply the second lowest cost silver plan that's available in a geographic area. So for instance, the benchmark plan in Oakland County might be a different plan, than the benchmark plan in, say, Lenawee County. So basically though, in whatever geographic area you are in, the benchmark plan is the second lowest cost silver plan available. And that's important because the premium for that plan is what the subsidy calculation is based on. But this chart just, simply put, shows at the various percentage of poverty level, the applicable percentage of a consumer's income they must generally pay towards that benchmark plan with the premium tax credit. Now, note, whatever the amount of the premium tax credit available, it can be used on any of the marketplace plans. It doesn't have to be used on the benchmark plan. The benchmark plan is merely used to calculate subsidy amounts. And so one thing that changed from the American Rescue Plan Act is prior to that, if you were at 400% of the federal poverty level or higher, there was no subsidy available. Okay, that was called the subsidy cliff. But the the American Rescue Plan Act temporarily eliminates that subsidy cliff. Now it's been extended through 2025. And certain households with incomes above 400% of the federal poverty level do qualify for subsidies because their premium towards a benchmark plan in 2022 cannot exceed 8.5% of their household income. In 2023, they've raised that percentage to 9.12%. So that is kind of a confusing slide, I know. And really the best way to look at subsidy eligibility would be just to go on healthcare.gov, and I'm going to show you that in a minute. You can do some window shopping, put in various income amounts to see, what type of subsidy you might be eligible for. So we'll walk through that in a minute. But before we get there, I just want to mention that, sometimes people ask, well, what counts into income, for the calculation of the premium tax credit? So they're based on modified adjusted gross income. And for subsidy purposes, MAGI, modified adjusted gross income, is defined as your adjusted gross income plus any untaxed foreign income, non-taxable Social Security benefits, and tax-exempt interest for the household. And this even includes the incomes of those in the household that are not applying for coverage. So oftentimes I'll have a couple where the one spouse might be Medicare eligible, but the other spouse is not, and that other spouse is looking for the premium tax credit, even though the Medicare eligible spouse is not applying on the marketplace because they're eligible for Medicare, we still have to include their income into the income equation. So what happens is you have to base the income you're looking at on the plan year that you are getting coverage. So if you're getting coverage for 2023, you actually have to estimate as best as possible what you think your modified adjusted gross income will be for 2023. And then what happens, since this is just an estimate, is a reconciliation will take place when the 2023 or whatever the plan year is you're on. When that tax return is filed, the reconciliation takes place. So let's say this is for 2023, and now you're filing that tax return in 2024. If the income that you reported on your application when you applied for coverage is greater than the amount of income that you actually earned, then when you file your tax return, you're going to actually receive money back because you overestimated your income on the application. So you will get whatever you would have qualified for back in your tax return. However, if you underestimated your income on your application, you will owe money back when you file that year's tax return. Now, there is no penalty, there is no interest, but there is a reconciliation that does take place. And I want to talk a little bit about cost sharing reduction. So remember, I said earlier on that some people not only qualify for premium tax credits, but also qualify for cost sharing reductions. Where you have to fall on the income scale to qualify for the cost sharing reductions is between 100% and 250% of the federal poverty level. So again, in Michigan, they did expand Medicaid. So really that window is between 133% and 250% of the federal poverty level. But if you fall in that area, you not only get reduced premiums, but you're also going to potentially get reduced deductibles and copays and out-of-pocket max. But you do have to enroll in a silver medal plan to get the cost sharing reductions. So we're going to look at this actually right now. I'm going to take you to healthcare.gov. And we're going to just take a look at some numbers and some premium amounts and some subsidy amounts. And I also want to show you a few things to avoid. So I'm just going through the screens right now to get me to the place where we can see the subsidy calculator. This time of year, we're not in open enrollment, so I have to check life-changing event to be able to look at the calculators. So I'm just going to say that I lost qualifying health coverage. And then I'm going to skip down here. What you want to be careful of is when you are looking to see what you might be eligible for, don't start an application. Okay, what you want to do is just window shop. So down here it says see 2022 plans before you apply with price estimates based on your income. That's the area you want to go. I've had people come to me after they've started this on their own, and they actually unknowingly submitted an application And I have one gal who, for her income, had put in 0 because she wanted to see full priced plans. Well, she submitted that application and then sent the application over to Medicaid because she had put in 0 income. And she got enrolled in Medicaid when she wasn't actually eligible for Medicaid. And then we had to go through getting that untangled. So just be careful when you're pushing buttons here. But if we just click on see 2022 plans before you apply and put in your zip code. And it says, tell us about your household. So I'm going to say this is just a single person, age 55, female. And they're just asking if, this person is eligible for Medicare, Medicaid, or CHIP, legal parent or guardian of a child under 19, pregnant, or tobacco user. So I'm just going to pick none of these. And let's just put in an income of 55,000. So 55 years old, 55,000 in income. So a few years back, that person actually would not have been eligible for a subsidy. The income would have been too high, but because of the changes with the American Rescue Plan Act, this person actually qualifies for $116 per month. So that just means whatever the full price of the plan, they would deduct $116. And you can view plans. You can add filters, maybe, there's a particular carrier you want to look at. I'll just pick Priority Health for today, but you can also look at all the carriers. And it shows you this amount that it's showing you is reflective of that $116 tax credit. So this first plan would normally be $414.78. But based on the $55,000 of income, it's reduced down to $298.78. And, this is where I feel like an agent can really bring a lot to the table because they're going to know more about these plans than what is going to meet the eye. For instance, this first plan is Ascension St. John Providence only. So you can only use doctors and hospitals that are St. John. So it's a very narrow network. If you wanted to see, let's just show you some silver plans. So I'm skipping down. Priority Health also has full network, a big, large network, but they do have, hospital-based plans. So you just have to be careful when you're looking at those hospital-based plans because they are very limited in network. Priority Health also has a plan. It's called their travel plan, where you can have access to doctors outside of Michigan for non-emergency needs. So it would be, the Cigna network outside of Michigan. So again, that's something that most of your plans nowadays only have emergency and urgent care coverage outside of Michigan. But this one is different. So again, something that, if you're working with an agent, they can educate you on some of these, things that are not necessarily going to meet the eye. But you can see as we start getting into the silver level of plans, the premium, now we're up to $453 a month. Normally it'd be at $569, but the deductible is now instead of $8,700, $5,500. Another thing to keep in mind, so the deductible is $5,500, but it still has an out-of-pocket max of $8,700. So if this person had something major going on, even though the deductible is a little less, they're likely still going to hit $8,700, just like they would on that first bronze plan I showed you. So sometimes people want to save the premium, and then if nothing, if they have no major incidences, they're just ahead because they saved that premium. If they pay more for the silver plan and have something major happen, they're still going to hit that out-of-pocket max anyway. So, but I want to show you what it looks like when somebody is eligible for cost sharing reductions. So let's just take the same 55-year-old female and let's put in an income of $30,000. I also want to mention in that retirement space, a lot of folks are actually able to structure their income in a way that they can take advantage of these subsidies and cost sharing reductions by pulling, from non-taxable accounts, as well as some taxable accounts. So that's where you can work with your financial planner to help you, determine a good income number for yourself. you know, and that's going to be, they're going to take a lot of things into consideration with that. But one of the things is, you know, what would it qualify for you for a premium reduction or cost sharing reduction on a marketplace plan? But at 30,000 of income, this person is now eligible for a premium tax credit of $422 per month. So quite a bit more. And down here, it shows you, you may be eligible for extra savings. So that's those cost sharing reductions I'm talking about. And it does say if you pick a silver plan. So we're going to view plans. And just to keep things simple, and I'm not, you know, advocating for priority health. I'm just trying to simplify what we're looking at here today. But yeah, the Ascension John plan we looked at a minute ago, now at 30,000 of income, has a 0 premium. Let's look at that $5,500 deductible plan. Okay, and that, well, here's one here. It is the Beaumont network, but it's $147.39 a month. But remember, the deductible a minute ago was $5,500, as is mentioned in the title of the plan name. So that My Priority Silver 5,500 means it's a $5,500 deductible. However, because this person is eligible for the cost sharing reductions, the deductible has been reduced down to $3,650 with an out-of-pocket max of $6,900. So that's an example of someone that's eligible for those cost sharing reductions. And I want to show you even one step further. So let's say that they're able to get that income down to 27,000. Premium tax credit goes up. I'm going to filter on a silver plan this time. Okay, so at 27,000, that deductible is still $3,650. So I got to go a little bit lower to get that deductible down. So I'm going to go down to 25,000 now, and I think that should get us there. But it makes a dramatic difference, and you'll see in a second. Okay, so silver, by filters. Look at that. So now that $5,500 deductible plan at 25,000 of income, again, for a 55-year-old, because it is going to be different based on age, but the deductible is now $700. So just, you know, kind of shows you what opportunities are available at different income amounts. And this is definitely a good way to, you know, look ahead of time and see what you might qualify for. You know, and all this being said, this is going to look different for 2023 because the rates are going to be different. Subsidies are going to be different. Plan deductibles usually go up each year, but at least it gives you an idea of how things look right now and how you can go in and estimate, you know, what your situation might look like based on various income levels. So now I'm going to go back, hopefully, to the presentation without exiting. Let's see. Trying to get back. Oh, here we go. Here we go. Okay. Well, let's talk about now, how do you use those premium tax credits? So the way that most people use them is they reduce their monthly premium each and every month by that premium tax credit amount. So basically, when you get the bill from the insurance company, it's going to reflect that premium tax credit and you're just going to pay the net amount. So the gross premium minus the premium tax credit for the amount that you would pay. Some people decide, you know, I'm not sure if I'm really estimating my income, you know, close enough. I want to play it a little safer. And they may decide just to take part of that premium tax credit each month, knowing that when they file their tax return, if they were eligible for the full amount, you know, that they would get that back when they file their return. I also have some people, and these are people that are really borderline eligible for a subsidy. So they want to enroll on the marketplace in case they end up being eligible. And sometimes we just don't know, especially like in a year where we have markets fluctuating like they are. You know, some years there's really large capital gains, other years there's not. But if someone is very borderline on whether or not they're going to be eligible for a subsidy, they may still want to enroll on the marketplace, but not taken up a subsidy up front and just wait until they file their tax return. And if they were eligible for one at that point in time, they would be able to retrieve that money in filing the return. So, but those are your options. So I want to put a big caution here. And again, this is where an agent can be helpful. Remember I said that there are some plans off marketplace that are less in premium than on marketplace. So here is a specific example. Priority Health has a $5,500 deductible plan on the exchange. In fact, we just looked at some of those. They have that same plan available off exchange. So exactly the same benefits. The full price on the exchange is $837.48 a month for a 63-year-old female living in Oakland County. Off exchange, that exact same plan for a 63-year-old female in Oakland County is $734.63. So I mention this because sometimes people will, they like to do this themselves. They'll go online at healthcare.gov. They're not eligible for a subsidy, but they still use the platform to pick their plan. So in this case, that would not be a good idea. They could go off marketplace and pick up that same coverage for $734. Well, for about $100 less a month. So there are also some Blue Cross plans that are less expensive off marketplace when you have to pay the full price. So just, a big caution there. I've known people that have come to me after the fact that have picked these plans on their own on the marketplace that aren't subsidy eligible, and they've just, ended up paying more for the same coverage. So be careful there. So when is open enrollment? It's a little bit different this year. It does start November 1st, as it has, in past years. But this year it is going to go till January 15th, 2023. And what that means is during that time period, if you don't have an individual health insurance plan and you want to pick one up, you can do so during that window. Also, if you are already on a marketplace plan or even off market and you want to switch your coverage for next year, that's the window of time that you can do that. So if somebody enrolls or changes plans between November 1st and December 15th, they will get a January 1st, 2023 effective date. If the enrollment or the plan change takes place between December 16th and January 15th, you'll get a February 1st, 2023 effective date. So I personally like that extension to January 15th because it just gives people a second chance, and we all like second chances. So outside of open enrollment period, there are other times when people can enroll in coverage, and these are called special enrollment periods. So you have to have a particular qualifying life event to be able to do so. And some of those life events include a marriage or divorce, the birth or adoption of a child. This is the one that is used most often, but the loss of employer-based health insurance coverage, which could also mean the exhaustion of COBRA, or if you're moving to a new city outside your old plan's coverage area. Another area is that involuntary loss of Medicaid, which I want to talk about more in a second. But basically, you have 60 days from the loss of coverage to enroll in a plan. If you miss that, then you have to wait till the open enrollment period. But I want to talk about involuntary loss of Medicaid because I've seen people get a little tripped up here. But normally, and this changed a little bit during COVID, but I think it's going to start up again. Normally, if you're on Medicaid sends you periodic letters requesting that you update your income information, and you have to fill out those letters and send them back. And then they let you know if you're still eligible for Medicaid or if you're no longer eligible for Medicaid. So if you send them the document they're requesting and they then determine that you're no longer eligible for Medicaid, that does open up a special enrollment period to get a plan, outside of the open enrollment period. However, if you simply just don't return the requested documentation to Medicaid, so let's say you got that letter and you ignored it and you didn't send back the requested income information, Medicaid can terminate your coverage. If that happens, that is not an involuntary loss of coverage, and that does not open up a special enrollment period. So you really want to be careful there. Make sure if you're on Medicaid, you're responding to any letters that you get, requesting income information. And last but not least, they did add an additional special enrollment period this past year. It was earlier in the year. But there are some people that if their income doesn't exceed 150% of the federal poverty level, so it's a small window, you have to basically be between 133% and 150% of the federal poverty level. There is now a year-round open enrollment if you fall into that income range where you can get a plan any time of the year. So again, it's a very small, percentage of people that might qualify for that, but it is something new this year, and it is year-round enrollment for people that are, in that range. This is, was going to expire at the end of this year, but under the Inflation Reduction Act, it is now going to continue through 2025. So that is all I have for you tonight. There's a lot. I'm sure people have different situations, specific circumstances that would require, further conversation than what I can present in a, general overview like this. But please feel free to, reach out to Sandy. She can direct pertinent questions to me so that, we can address your specific situations. But other than that, that's all I have for you tonight. Again, if you're coming up to Medicare eligibility, please think about attending the webinar in October, because there's a lot of good information coming in that. There were some changes related to Medicare, that will start in 2023. So I would, look forward to being able to speak to that again in just about a month. So thank you, Sandy, for the opportunity. Thank you to those who attended, and please feel free to reach out if you have any questions.
Yes, thank you, Cynthia, so much. And just as a reminder, if you have questions for Cynthia, you can reach out directly to her, but if you would feel comfortable, more comfortable reaching out to your planner or to us at the center, please do that. If you have questions that relate to your situation and insurance of any kind, or would like to take us up on that offer for a one-on-one session, please reach out to us, and we're happy to take you up on that and schedule that. So please reach out to us for that and any other financial planning related questions. We're so happy that you joined us, and we hope to see you soon, either at the Medicare session or for any of our year-end tax planning and other sessions coming up soon. Thank you again for joining us, and we'll see you in the near future. Thanks so much.